This is going to be a quick video about how to remember Coumadin versus heparin, which lab you draw, what pathway they act on, and what you give as a reversal. So I'll explain these and give you a few memory tricks to remember which goes with which. So Warfarin, also known as Coumadin, you check a PT-INR. I remember this because you have to do PT if you are in ROTC or some kind of military program. If you're preparing to go to Warfarin. So you go do PT and exercise to prepare for war. Warfarin acts on the extrinsic pathway. So I'll do a different video on the coagulation cascade. Basically, there's an intrinsic and an extrinsic pathway that both result in a final common pathway. So Warfarin works on the extrinsic and the common final pathway. So my trick for remembering this is when you're doing PT to prepare for war, you go outside, extrinsic, you go outside to do your PT training, physical training to prepare for Warfarin. You reverse Warfarin with vitamin K. So my trick for this is if you take the W in Warfarin and split it up, you get V for vitamin, and then you take this half and you turn it on its side, and you get K. So vitamin K. So Warfarin is a blood thinner. It acts on the extrinsic and common final pathways to measure the level of Warfarin and its effect on the coagulation in someone. You measure a PT-INR because you do PT outside to prepare for war, and reversal is vitamin K because the V and the K here can be incorporated into the letter W for Warfarin. Heparin, on the other hand, you do a PTT, so partial thromboplastin time. And I remember this because you can take the two T's and make them into an H for heparin. So PTT, the two T's come together to make an H that stands for heparin. Heparin acts on the intrinsic pathway as well as the common final. And so I remember H for heart, intrinsic, inside of you, your intrinsic desires are in your heart. So intrinsic cascade, intrinsic pathway for heparin or your heart. You reverse heparin with protamine sulfate. And I remember this because you had the heparin, the H, looks like these two T's together in PTT, and protamine sulfate also has a P, a T, and a T in it. So protamine sulfate has a P, T, and a T in it for PTT, which has to do with heparin because we put these two T's together and made an H, and it works on the intrinsic pathway, which is close to your HE for heparin, HE for heart. So I hope that helps you remember Warfarin versus heparin, the labs you check to look at these, what pathways they act on, and how to reverse them. Thank you.